Okay, we're gonna do subcutaneous heparin injection. I'm going to first wash my hands. And I'm gonna check the 6 rates for medicating for medication rates, right dose, right time, right patient, right medication, and then right documentation and location for the injection. So I'm gonna come and introduce myself. Hi, my name is Hannah. I'm gonna be your nurse today. I'm gonna explain the procedure. I'm going to verify the identification of my patient that I'm going to be doing the injection on. So, can I please get your name and date of birth?
Ramona, 8475.
I'm going to just double check with her doctor's order to make sure that I have the right medication as well as her MAR. And while I'm looking, I might just want to double check, make sure that she doesn't have any conflicting allergies with the medication. And then I'm going to go ahead and get my medication ready after she understands the procedure. I'm going to use this heparin ampule. If there's liquid in the top, you can go ahead and just tap it out of the top. I'm going to use an unopened alcohol prep pad to open the top of this. I'm going to break it away from me, just like that. Throw that in the sharps. I have a heparin needle here. It's a 1 milliliter, 27 gauge, 1/2 inch needle. But to draw up the medication, I'm going to use a filter straw since it came out of an ampule. So I'm going to unscrew the needle. Attach the filter straw, and you can, with the ampules, you can tip them over to draw up your medication. Mine leaked a little bit while I was practicing, so I'm going to leave it just tilted, and I'm going to, without touching the edges of the ampule, draw up. 0.3 milliliters of medication with, and then I'm going to discard my ampule and the sharps. Going to add about 0.1 of air. And then I'm going to go ahead and unscrew my filter needle, or straw, I guess, and reattach the needle I'm going to use for injection. Then I'm going to put my gloves on. And for subcutaneous heparin, you want to administer 5 centimeters or about 2 inches in any direction of the belly button needle. So here's our belly button. I'm going to use an alcohol prep sheet to clean the area in a circular motion, going from in to out. Make sure you get it good and clean, and then make sure that's nice and dry before you start injecting anything, to avoid any discomfort. And then I'm going to go ahead and uncap my needle and pinch the skin where I'm going to inject, and at a 90-degree angle, I'm going to go ahead and quickly and then withdraw. Okay, so to recap my needle, I'm not going to touch that. Throw it in the sharps. You don't have to recap the needle to throw it in the sharps. And if there's any bleeding, you can use some gauze or a cotton swab to dab, but don't ever massage or rub, unless for whatever reason that was ordered by the physician. And then you can take off your gloves. Make sure that your patient is comfortable, tolerated the procedure okay, make sure you're leaving them in a comfortable state, and go back and document tolerance of the procedure, where you do the injection, and amount and all of that good stuff. So thank you, Ramona. We'll see you soon.
You're welcome.